An employee of this long-term care facility has one of the latest cases of COVID-19 on P.E.I. That's why all of the residents and staff here were tested. The results came back negative, but everyone will be tested again later this week, all in an effort to try to limit the spread of the virus after 5 cases were detected on the island.
But this cluster of cases is a clear reminder that COVID-19 is still very much present in our province and we must remain vigilant.
P.E.I. hadn't had a new case of COVID-19 for 2 months until this weekend. 4 of the cases, including the care home workers, are part of a cluster. It appears to have started when a young man from P.E.I. went to Nova Scotia and visited someone who recently traveled to the U.S. And then he returned to the island.
Over the past 24 hours, we have conducted extensive contact tracing.
Officials pointed out that these cases were spread before Friday when the Atlantic bubble came into effect. Residents can now travel freely between the 4 provinces without having to self-isolate.
Things should go relatively smoothly.
This epidemiologist says people shouldn't feel too anxious about limited travel, as long as they follow the recommendations.
I'm looking for people to be wearing masks indoors and maintaining social distance whenever they can. I think these things can't be underestimated, quite frankly.
Experts say as the economy in more parts of the country open up, more coronavirus cases are expected, even in areas where there were very few before. That's why contact tracing is key.
What's needed is to be able to descend on those handful of cases and prevent them from becoming outbreaks. 1 or 2 cases is not an outbreak, and prevent an outbreak from becoming an epidemic.
Failure to trace and isolate cases like the ones on P.E.I. will mean the only option to stop the spread is another lockdown. Briar Stewart, CBC News, Vancouver.